So what do a hospital room and a teenager's bedroom have in common? Well, turns out not a whole lot, but that is what inspired 16-year-old Anna Reed to start her own nonprofit to help change that. At 14, Reed was diagnosed with osteosarcoma when a cancerous tumor was found in the bones of her arm. After spending the better part of a year in the hospital, she formed a community with patients and nurses. Colin Riley with Scripps News Group in Denver shows us how she's now found a way to give back.
When Anna Reed was 14 years old, her lifestyle was pretty typical for someone her age. She liked to hang with friends and spent much of her time as a three-sport athlete. But a day on the lacrosse field changed her life to anything but typical.
I started to notice a pain in my right arm. I would start to ice it and put heat on it, and I would stretch and everything, and the pain just wouldn't go away.
Reed thought her shoulder pain was from overuse, but the pain would get worse over time. One day, while putting on makeup,
my arm just started to shake.
Reed and her mom knew it was time to visit the hospital, and it was there she received devastating news. She was diagnosed with osteosarcoma in her right arm.
My stomach kind of just dropped to the floor.
She spent almost a year in the hospital, waiting through the stress of chemotherapy and a successful surgery to remove cancerous tumors.
It was around 6 inches that they cut out, but they had to replace it with dagger bone, titanium rod, and a titanium plate.
It didn't take Anna long to realize how uncomfortable a hospital room was. The mattress, the fluorescent lights, a cold tile floor. That's what gave her the idea to bring some comforts from home, her own bedroom, into the hospital room.
Blankets, sheets, my own pillow. I bring in Christmas lights and different posters.
Reed's room at home was a stark contrast to the sterile hospital room she lived in for months.
If I have to stay here constantly and be here for a week at a time or so, might as well make it feel like home.
Other pediatric patients and even the nurses on Reed's care team would stop by for a place to relax or have a snack.
It definitely relieves some anxiety for me.
That relief inspired Reed to start her own nonprofit, Anna's Room, as a way to give back to the community that saw her through a tough time in her life.
But it was just a crazy idea of mine, and it's being brought to life.
Reed is now busy building comfort kits to give to teens like her and a chance to make their hospital visit a bit more like home. The kits are complete with sleep masks, blankets, lights, and other comforts curated for each individual.
I'd like to bring people joy and give them a sense of relief.
In Denver, Colin Riley, Scripps News Group.